Welcome to Windsor 411 Talk. I'm Ida Terry, your host. Our topic today is opioid and opioid addiction. Before we get started, I feel compelled to disclose that just minutes before this interview, I was in my dentist chair receiving Novocaine. Don't be alarmed. Novocaine is not addicting. It just makes the trip to the dentist's office a little bit more tolerable. Unlike opioids and opiates, opiates and opioids are not the same thing. Sometimes people use those terms interchangeably. They are similar to each other in that they are used for pain relief. Opioids are synthetic drugs like fentanyl, methadone, and Percocet. There are also others, whereas opiates are natural drugs that are made from the opium poppy plant. Today I will be speaking with Mark Jenkins, harm reductionist. He's also executive director of the Greater Hartford Harm Reduction Coalition. Mark will be discussing the role of Narcan in the fight against opioids and opiate addiction. He will also be responding to a web article related to the subject. Mark, before we get started, I want to read a portion of the article by Jake Cara entitled, "Who is Dying in Connecticut's Opioid Overdose Crisis?" Jake goes on to say, questions have been raised about whether the attention paid to the rise in opioids death is related to its disproportionate impact on whites. In Connecticut, that racial disparity is real and growing. Who is dying in Connecticut opioid crisis? Mark, welcome to the show.
Thank you. Good to be here.
How would you respond to that very provocative headline?
It's interesting. It begins to skirt around some of the real issues. We have long had crisis around illicit substance use and abuse in the inner city. Mm-hmm. And so long as it remained within the inner city and city limits, it wasn't a crisis. So is it now because of the disproportionate number of white people that it affects? 100%.
Okay.
If it were not for the fact that now young white people, men and women, are dying, it wouldn't be a crisis.
You said earlier, you asked the question earlier, what kind of answer should you give me to that particular question? You hesitated. Talk a little bit about how come.
Truth isn't always popular, and especially in our culture. The truth isn't pretty always, and it begins to show where a racial divide and disparities still continue to exist, even though people would like to act or as if they didn't.
Okay.
We've had many efforts, and the way things are going now, still the response to this epidemic has not been targeted for the most part to the inner city, but to the very same people that it affects that are outside of the city.
Okay. You mentioned that. However, there is a program in Hartford, one at the Hartford Dispensary, and there's also one on Fish Fry Street, right? Mm-hmm. Could you talk a little bit about those programs and who they're serving from your perspective?
Well, again, you're talking about medication-assisted treatment programs. Those are methadone clinics.
Okay.
The Hartford Dispensary and they recently changed their name. It used to be Community Substance Abuse, but they have a new name now.
Okay.
They do target, by and large, a great portion of the inner city, those who do access those services. But because Hartford Dispensary also has locations outside of Hartford,
Okay.
whereas Fish Fry, as you related to, that's their only location in Connecticut. They're a Massachusetts-based company. But that is a very popular and one of the suggested ways to make more access to medication-assisted treatment and beginning to combat this epidemic.
So, methadone is one approach to dealing with the opiate epidemic that is in Connecticut. In fact, is nationwide. Okay.
Nationwide, it is presently the #1 cause of accidental death in the United States.
Okay. And tell me a little bit more about what your organization is doing to sort of combat this. Because I know you guys have one approach to it, and I believe that's Narcan. So why don't you tell us a little bit more about Narcan?
Well, naloxone is the generic name. Narcan is the brand name.
Okay.
Naloxone is a tool. Like anything else, it's a tool that its primary purpose is to reverse the effects of an opiate or opioid overdose.
Okay.
Our position is to make sure that it gets into the hands of the people who need it most. Again, in Connecticut, say in 2015, depending on whose numbers you look at, we lost somewhere between 680 and 723 people to fatal overdose. Those numbers are supposed to increase when the formal numbers come out for 2016. The only way we are going to begin it's going to take a multifaceted approach to get these numbers down, but personally, I don't believe these numbers will come down anytime soon because, again, market demand and how we got here in the first place. But Greater Hartford has a position that we need to initially get this medication into the hands of active drug users,
Okay.
to make sure that they have some information along with that, and that, again, they become a network in addition to further that reach to help keep people alive.
Okay.
Again, Narcan's sole purpose is to reverse the effects of an opiate overdose. And we have to make sure it gets into their hands.
Okay, and talk a little bit more about getting it into the hands of the people who really need it.
You know, we're grateful that our first responders here in the state
Okay.
now carry naloxone, but true first responders are the people who also are using with those people who overdose. So they're the ones that make the phone calls to 911. They're the people who are most effective in helping to reverse overdose. These are other active drug users. So other active drug users are responsible for some 82% of all the overdose reversals, whether they made the phone call or had naloxone present themselves. Another 10% by family and loved ones.
All right.
Many times a parent will find their child suffering from an overdose and are able to reverse it. And then another 0.2% come at the hands of programs and people associated with programs. So those numbers aren't numbers that we make up. These are numbers that the CDC put out.
Okay.
And just really shows the importance of making sure that this medication is in the hands of the people who need it most, which is what's my mantra. Let's get it in the hands of the people who need it most.
You mentioned earlier first responders. When I think of first responders, I think of police, fire, but I didn't hear you name any one of those people in that group.
Well, that's why I give credit to those public service agencies
Okay.
that do carry it. They are formally the first responders. What I say is that the true first responders are those who are there that find the people.
Okay.
That's your first line. That's your
Yeah.
first line of defense.
Yeah.
So that's why I call them true
And I
first.
know a number of towns, and I don't know if our town actually, if our first responders carry Narcan. That would be my homework for next time. But I want to go back to, you said sometimes family members find the person who's OD. Talk a little bit about what you've heard clients say about that.
Well, we offer, first of all, we offer trainings open to the public every Thursday.
Yeah.
Every Thursday from our office, 7 o'clock. And we encounter parents all the time. I've also done trainings for support groups. And we've encountered parents who've lost children, those who have revived their children. And it's all the same. They're either grateful that they had it on hand so that they were able to reverse that overdose and then wait for a response from paramedics and then eventually get those children into treatment. But what they all acknowledge and agree on is that we have to keep them alive.
Yeah.
We have to keep them alive. See, naloxone, people say and have said that, oh, if you give people Narcan, naloxone, you give them a green light to use. And it's not factual. This is coming from a personal and a biased opinion. And I put to you, when you see a fire extinguisher, does it make you want to start a fire?
Great analogy. I have no comeback. But what I think is really interesting and actually cutting edge, progressive, if you will, the Connecticut Department of Correction have invited you in to talk to the addicts who are currently incarcerated about Narcan and reversing the effects of overdose. And I know you do a segment for me at our prison in Hartford, CC. Talk a little bit about what it was like to convince corrections to allow you to come in and talk about Narcan.
It was a long process of meetings and people warming up, but to the idea. What the facts are, it's a population that was the highest risk and at the highest risk and continue to be. In fact, ex-offenders are 130 times more likely to die of fatal overdose than their counterparts who don't have that background. They're most likely to die within their first 14 days of release, and then from there it peaks at about 30 and then falls off, you know. But of the number of fatalities that we had in 2015, some 40% of the fatalities that we had a connection to DOC.
Connection?
Yeah, meaning they had come through Department of Correction at some point.
Despite the fact that we have these fabulous, effective drug programs.
Listen, times have changed. Our message has to change.
Yes.
How we approach things
Right.
have to change. The face of addiction has changed.
Yes.
It's no longer the proverbial junkie on a park bench or by the railroad tracks seeking. It's the person who started out on prescription pain medication who no longer has access to that medication, who now, for whatever reason, is continuing on that path and will seek not to be sick, which is what happens as a result of not having whatever product, opiate, that you had. When it's not present, the body goes into a state of withdrawal. So it's not a popular place, it's not a fun place to be, and people will seek other means to fill that need.
Now, talk a little bit about how your message was received by the people who are currently incarcerated.
Well, I mean, the inmates themselves, it's not hard to convince them. I have yet in over a year of doing groups, had one group where I posed the question, has anyone here, does anyone here have anyone close to them that's died of an overdose?
Wow.
And I've yet to encounter one group where 80 to 90, if not 100% of the room answered yes.
Wow.
And not long ago, like in recent memory. So yeah, so it's not unfamiliar to them.
Yeah.
It's the stigma still associated with it and everything, and that this seems, and I don't want to use the word, I don't want to offend people, but then again, I really don't care, that it's a disposable population.
Yeah.
And if it had not been, then why does it take so long to affect change? When we've had other epidemics to take place in this country, we respond in like manner.
Yeah.
But with this population, we have not. So why?
That's a good question. One, I'm not real sure if we have the answer to. Okay. Talk about one of the most unique things that you, maybe conversation, that you've had in prison that you haven't had outside, as you talk about Narcan and the importance of getting it to the people who are currently incarcerated just prior to them going out the door.
Well, it's, again, it's still new. It's still in the works. We're still in our first pilot phase, and it's a work in progress. And I applaud Department of Corrections because now methadone will soon be in Hartford County, as it has been in Bridgeport and New Haven. Some of the, when you find someone who not only acknowledges the need, because again, not everyone is going to follow a path of abstinence.
Yeah.
And for those who know that they are going to use when they return to society, and now want this in place, and wish they had had it for others that they knew, we're doing something right.
Yeah.
We're doing something right.
And that feels pretty good.
Yeah.
Mm.
Yeah.
Okay.
Yeah. I mean, I've done so for the past 2 years without pay.
We appreciate your service, sir. How come you do it without getting compensated on it? What motivates you?
I'm a harm reductionist. I am a harm reductionist. It is my duty as such. People and Greater Hartford Harm Reduction Coalition is a harm reduction agency. Our mission, service, and values are predicated on that fact that we encounter someone around illicit drug use, that we try and make their life a little safer, that we try and leave them in a little better position, if it's just from information, from listening, from helping to remove barriers, from providing services, direct services, which are always low threshold, but effective services, that we try and make a difference in that individual's life, and that we try to promote any positive change, whether it is showing someone how to use safer,
Wow.
where they are, all the way to abstinence.
Yeah. As a licensed alcohol and drug counselor, I kind of cringe when you say help someone use safer, because for so very long, I feel came from a strict abstinence model. and especially working within a criminal justice agency, it's really hard to think about harm reduction because drugs, as you know, cause so much collateral damages within our community and pretty much nationwide. So for some of us, we are still struggling with that. And, you know, we struggle because of all the damages that happens when a person uses, not just to him or herself, but to the family, to the community, to the state. And we all pay in some way. Some addicts, opiate addicts, because that's kind of what we're talking about that today, sometimes they pay the ultimate price. And then the family still has to pick up that wreckage that's left behind. Mm-hmm. So it's a struggle for many of us. Mm-hmm. When you say we help them to kind of use safely?
And to remain safe. I mean, from a programmatic standpoint, from a cost standpoint, by keeping people safe, reduces medical costs for emergency room, for treatment of abscesses, by making sure someone has clean syringes, is proven to have saving just millions and millions of dollars on the health field or on the individuals and society for reducing the amount of HIV.
You are exactly right. The research is there. And I think that is what's helping us, especially within the criminal justice system, to sort of change our mindset and start to change how we talk about, how we treat addiction. In the criminal justice system, in terms of what it's doing for recidivism. Recidivism is going down. And research says that as a direct result of medical assisted treatment. We're getting near the end of our time today. And I just want to thank you for coming and perhaps have you think about coming back again so we could finish this topic and hopefully, I promise, I will not be on Novocaine. And Novocaine doesn't give you a high or anything. It just take away the pain of the drilling. But again, Mark, thank you so much for coming here today. Thank you for talking about this interesting yet provocative topic. I'm Ida Terry, and this is Windsor 411 Talk. You've been listening to Windsor 411 Talk with Ida Terry and Mark Jenkins. And I just want to say, if you see someone who you think might be overdosing, please don't try to handle it yourself. Please call 911. This is Ida Terry, Windsor 411.